Hi, I'm Addie, and this is our presentation about the healthcare systems in Russia. Private health insurance and government health insurance in Russia. In Russia, there are two forms of health insurance, OMC, which stands for Obligatory Medical Coverage, and DMC. OMC is health insurance provided by the state and is free to all citizens and non-citizen residents. DMC is private health insurance and can cost anywhere from 10,000 to 45,000 rubles depending on the type of insurance plan and the amount of medical care received. In US dollars, this converts to about $131 to $589.50. No insurance plan covers pre-existing conditions or terminal illnesses. Private health insurance and government health insurance in the United States. In the United States, there are different types of health insurance, including private health insurance and government health insurances, such as Medicaid, Medicare, and CHIP. Private health insurance is paid for by the individual or by a large company for the employees and covers different types of medical care depending on the plan that is bought. Medicaid is a jointly run federal and state government insurance plan that provides health insurance to people with low incomes, pregnant women, disabled children and adults aged 65 or older who meet the federal poverty level. Medicare is a federally funded health insurance program that covers most medical costs of people aged 65 and older and certain people who are permanently disabled under the age of 65. The Children's Health Insurance Program provides health insurance to children whose parents make too much money to qualify for Medicaid but cannot afford to pay premiums for private insurance. Access to health insurance in Russia. OMC is free for all citizen and non-citizen residents but does not typically cover many major procedures or treatments. Also, OMC only applies at certain hospitals and different circumstances may lead to the patient having to pay their entire medical bill. DMC is privately purchased insurance that covers both inpatient and outpatient treatments, as well as doctor's fees, diagnostics, medications, ambulance transportation, and more. Private health insurance is not widely available in Russia due to the fact that it is mostly bought out by large companies to provide insurance for their employees. Many Russian citizens choose OMC insurance and then create personal agreements regarding payments with their primary doctors in case of an emergency, rather than paying for private health insurance. Access to health insurance in the United States. Private health insurance is the most widely used health insurance in the U.S. Private health insurance can be obtained through a company job or purchased individually through a marketplace. Private health insurance can be very expensive for individuals depending on the insurance plan and the amount of medical care they received. In 2020, the average national cost for private health insurance per person was $456 per month. People who qualify for Medicare, Medicaid, and CHIP must apply to the specific program, and their application is reviewed by the insurance company and the government to determine if they are eligible to enroll for the insurance coverage. They can either apply on their computer or mobile device through the internet, or they can be referred by other healthcare providers. In March of 2010, President Barack Obama signed the Affordable Care Act into legislation with the purpose of increasing access to health insurance for individuals while also maintaining the price of healthcare costs. The ACA allows for millions of Americans to have access to health insurance and the medical care that they need.
The cost of Russian medical technology. In 2018, the average cost to get an MRI was 4,000 to 12,000 rubles, which is $54.68 to $158.76. The cost of an MRI is determined by which body parts are being scanned. In Russia, they spent an average of $160 per person on prescription drugs. $19.9 billion of pharmaceuticals were sold to Russia in 2019. To get a blood test at a lab, it would cost on average 382.06 rubles, which is $5.05 in American money. The cost of American medical technology and how much we have to pay for it. On top of this slide is a chart to see how much an MRI costs depending on what insurance you have and where you get it. With all that, the average cost of an MRI scan is $2,611. And for prescription drugs, on average, people under 65 pay $177 out of pocket for prescription drugs. People 65 and over pay an average of $456 out of pocket for their prescription. And to get blood work done can range anywhere from $100 to $3,000 for a complex test. On average, it will cost around $1,000 for uninsured patients for a blood work test. Does every Russian citizen have to have health insurance? In Russia, there are two types of health insurances, OMC and DMC. DMC is privately owned health insurance that you have to pay for yearly. It will provide you more healthcare and more options. OMC is the free insurance provided by the state. It will cover a patient for basic health checkups, but it will not cover it for vital treatments, and it's only covered at specific hospitals. In conclusion, every citizen will get health insurance no matter what. If they cannot afford the DMC, they will be given the OMC health insurance option. Does every American citizen have to have health insurance? Is it mandatory? In America, there are 5 different types of insurances you can get, including the Health Maintenance Organization, Preferred Provider Organization, Point of Service, Inclusion Provider, and High Deductible Plan. On average, health insurance for an individual is $456 and $1,152 for a family. Even with many plans, health insurance is not mandatory for anyone. But with the Affordable Care Act, it had become much easier for people to obtain health insurance and pay for it.
Specialists and services provided in Russia. Russia has a range of excellent doctors and specialists. The only negative side is that in the state hospitals, you might have to wait a long time before you can actually be helped by a specialist. Also, women have access to services such as gynecologists and maternity care specialists for when they are pregnant. And in most hospitals, there is also a children's section where they have access to special services such as pediatricians and child psychologists. Specialists and services provided in the United States. In the United States, there are a various range of different kinds of specialists that all provide different healthcare options. You can find these specialists in a hospital setting or in a private practice setting. When compared to Russia, there are more opportunities to be able to contact different specialists in a more timely manner. Some of the specialists that the U.S. has to offer are cardiologists, dermatologists, radiologists, vascular surgeons, and many more to choose from. Healthcare facilities in Russia. There are 3 main types of hospitals in Russia: state facilities, private facilities, and Western-oriented private facilities. The private facilities are also where the highest forms of customer services are provided. There are also many forms of private clinics that can be found in Russia. Most of these clinics are private, and your access to them will depend on your location and what kind of care you need. Healthcare facilities in the United States. There are multiple different types of healthcare facilities that are available in the United States. The main facilities are hospitals and clinics that can be found throughout mainly every large city. There are also other forms of healthcare facilities such as birth centers, blood banks, imaging and radiology centers, nursing homes, mental health centers, urgent care clinics, rehab clinics, and so many more. These all can be found throughout the United States, and it's easy for a person to have access to the facilities and the personnel that work there. Services ranking in Russia compared to the United States. When looking at the Healthcare Index by country for 2021, Russia and the United States ranked as the following. The United States ranked as number 30 with a healthcare index of 69.03. Russia ranked 60th with a healthcare index of 58.44.